Hi, this is Dr. Ernst. You probably heard this last week that the American Heart Association, along with the American College of Cardiology, issued new guidelines about blood pressure. According to them, an additional 30 million Americans now are considered hypertensive because the guidelines lower the pressure limit for diagnosis by your doctor. In a way, it's actually a good idea because it means we're starting to set a higher standard for optimum health. But on the other hand, it means an entirely new group of Americans who, before the announcement, never qualified for prescriptive therapies are now having to have conversations with their doctors about what pill to take. Do you remember when this happened years ago as cholesterol numbers were lowered? It's packaged as prevention, but in fact it's designed to expand the pharmaceutical reach in the United States. Our healthcare system really is a sick care system. And while the new guidelines come with recommendations of lifestyle changes like diet and exercise, the delivery method is broken. Getting diet and exercise advice from medicine is like getting your oil changed at the grocery store. They're simply not trained, nor are they equipped to help you turn your lifestyle around like that. So today I want to share with you 10 powerful blood pressure techniques that I've discovered that don't just uncover symptoms of high blood pressure, but they actually seek to correct the cause, which is chronic inflammation. So first we want to go for a high-fat diet. Fat by definition is anti-inflammatory and it's also alkaline. So this means things like olives and flax and chia, fatty wild-caught fish, avocados, coconut oil are great for your health and for your heart. You can even supplement them by doing the omega-3 oils. One of the main causes of high blood pressure is inflammation in your arteries, and fish oil and seed oils are packed with omega-3s that have been shown to lower the arterial inflammation, which helps to lower your blood pressure. Chiropractic care has also been shown to reduce the stress on your vagus nerve and lower cervical and upper thoracic nerves, which studies show directly impact your blood pressure. In fact, a study done at the University of Chicago found that an adjustment was as effective as dropping your blood pressure as taking 2 medications, but without any side effects. Potassium also acts to decrease blood pressure because it does the opposite of sodium. So it helps to dilate your blood vessels, which will help to decrease your pressure. By the way, don't think of potassium as in being in bananas because an avocado has more than a banana with no sugar. Coenzyme Q10, also called CoQ10, is a great supplement for high blood pressure because it's crucial that your heart can transfer electricity from top to bottom properly, so it helps to enhance the conduction, which will also decrease the electrical stressors on your heart. You've probably heard the one about how dark chocolate is great for your heart health. Not only is it full of healthy fat, but it's loaded with magnesium and something called cacao phenols, which have been shown to lower your blood pressure. We know exercise is good, but it doesn't have to be a lot. Something as simple as maybe a 10 to 15 minute walk has shown to decrease blood pressure more so than medications, and it's not a lot of time and it has a profound effect on your heart. We know sugar's a big problem because it causes inflammation, so we need to get rid of it, but it's everywhere and chances are you're eating way too much of it. We know it inflames your arteries and it also increases the thickness of your blood or the viscosity. The harder and thicker your blood is, the more difficult it is to push through, so that's why sugar is connected to high blood pressure. We also want to eliminate or limit our alcohol consumption because it's basically another form of sugar. It narrows your arteries and it makes it harder for the blood to flow through, which causes a rise in blood pressure. Lastly, we want to get more sleep. There's a direct connection between sleeping less than 7 hours a night and having high blood pressure. So focus on 7 to 8 hours every night and even consider grounding yourself because that's been shown to decrease your pressure. Don't let these new guidelines trick you and bring fear into your life. It's absolutely true that we should take our heart health and our blood pressure more serious. But it's not a matter of seeing a number, panicking, and running to take a medication. Your lifestyle is a series of actions you take every day that are meant to keep you healthy, and that's the approach you should focus on. If you like today's video, please share this with everyone you know. It's an estimate that 50 to 60% of us will have a heart health crisis at some point in our lives, and the information here is the very thing that maybe your friends and family need to hear. Thank you.